All right. My name is Alison Broussard. I'm a certified ARISE Interventionist. I'm from the Houston area, specifically the Woodlands, but we cover all of Houston, actually all over Texas and the United States and beyond.
My name is Tanya Cook, and I am also an ARISE interventionist, and I do partner with Alison. We do interventions together, and so also in the Houston area. And as she said, we're really all over, and this is just something that we really love to do. We love helping families. We love helping individuals, and it's our passion and our dream to keep doing this.
Thank you. Welcome. Really excited to have you guys with us. It's such interesting work, intervention, really. It's such an important piece of the journey to get someone the help that they need. So I have tons of questions, and there's lots I want to hear from you too. But let's start from the beginning. You guys said where you're from, but I'd love to hear how you got into what you do. And whoever wants to start.
Okay, so I got into this. I actually left a corporate America position of 25 years after going through well over a decade of dealing with addiction in my family. I have 4 sons, and my 2 youngest struggled with opioid addiction in particular. So it was quite a journey. It's always a journey. We're still on that journey. And lots of ups, lots of downs, lots of treatments, lots of not knowing what I didn't know. And really pouring myself into just family education and just doing my best to support my sons, knowing that I had to. I'm beginning to get emotional. I just knew it. I mean, I just knew probably for the last 2 or 3 years of my prior career that all of that pain that we had gone to needed to be turned into a purpose. And it would just be in vain if not. And I had learned so much, and I knew I had a lot to give others. And so that's why I do what I do.
I think for me, I'm a woman in long-term recovery from alcohol. And about 10 years into my recovery journey, I began working at a treatment center. And I remember that one of the craziest things is one of the prerequisites for working there, for doing that particular position, was that I had this history with a struggle. And I was going to be teaching Big Book at this facility and helping their clients or their patients actually with the next part of their journey. So they'd been in inpatient treatment and then next, because we know this is a lifelong journey. And so working in that continuing care area allowed me to build up my, the resources that I had and to know different programs that were out there and really just communicating. I mean, I was, getting to meet with these clients day in and day out to talk about what it looked like to live the recovery journey. From meetings, sponsorship, IOP, PHP, all the next things. I think for me, there were times also, just in speaking about intervention, I remember working for that same facility and had introduced treatment to some people. And I remember the lady that had come to go to treatment, she'd come to just visit, but she was leaving. She didn't want to stay. And so they brought me in and said, do you want to give it one last shot? Do you want to talk to her? And so I do remember kind of, praying the whole way down, like, I don't know what she needs, but I know she needs something, and maybe some words that I might have for her, could potentially change the course, of what she had decided to do. And so she ended up staying in treatment. I think that sparked my real interest in intervention work, even though I didn't really know that that's what it was, and so, that just kind of led to the next thing that led to the next thing. And all of a sudden I remember, starting looking into different models of intervention and really landed on ARISE because of what it encompassed, the entire family component. It wasn't a short-term, quick, throwing someone off guard, just getting them into treatment. It was really a longer term, the whole family, it was like this work that was going to be supported, and there's so much more, but anyway, that's really kind of how it started.
Great. Well, yeah, let's continue with that, because I do want to know also, I mean, it is a bit of a niche being in intervention, and just knowing what I know of that work, from being a clinician myself, it can be a very high intensity, and it takes a lot. So I am interested to hear, and either of you can answer this,
Sure. Yeah.
what model you use, what you love about the model you use, what could be, improved upon maybe, or just how do you do this type of work? It's hard work. Yeah.
So interestingly enough, I was actually exploring what type of intervention. I knew I wanted to do intervention. I really didn't know where to begin to start looking at the different models and, which one to train in. And that's actually how I got introduced to Alison. I had actually a family that she was working with. I was networking with this individual, and she said, you really need to meet Alison Broussard. And so I kept hearing Alison Broussard, Alison Broussard.
I think I'd already heard your
name. Yeah. And so anyhow, so I looked into it. So ARISE is actually, I believe, the only evidence-based interventionist model that exists out there. And so for me, because I had kids that were chronic relapsers, or some people call it chronic relapse, some people call it treatment resistant. All I know is that we kept having to go back. Okay, and so this notion of I looked at the statistics, and the statistics for the ARISE model. ARISE is an invitational model. So if you think about it with some other, and there's a lot of other great intervention models, but with some of them, the individual is caught off guard.
Yeah.
So they're very angry, and so they're going to come to treatment, and for the first week minimum, if not 2 weeks, they're just mad. They're mad at their family, and so they can't really get into their recovery. And so I think the first thing that caught my attention was that it was invitational versus confrontational. And because we actually invite them to the table and actually create a scenario with a network of individuals, the family, we solicit their involvement in agreeing with the family that, yes, in fact, they do have a problem and they need to get help. So they come in voluntarily. I mean, we're not saying that they come in skipping and jumping and just I'm not really sure exactly who comes into treatment that way. But I will tell you, because I spoke of the statistics, we work long term, as Alison said, with our families. So we contract for 6 months. Minimum. And so the statistics are that in the first week of meeting with the family, that 60% of our individuals will be in treatment. And by 3 weeks, over 80% will be in treatment. So, but the best statistic that I love is that once we take an individual through this entire 6-month process, and their families, because the family component is so important, and this is the evidence-based part of this, that nearly 60% or a little over 60% will still be clean and sober 1 year out. So I don't know about you, but the statistics that I usually see are single digits. So for something that lends, even if you want to cut that in half and say 30%, it's a good model. Do you want to add to that?
I'm thinking through that. There's a lot to say, but I don't know if you had another question that you wanted to ask.
I have plenty of questions, but if you want to add.
Okay.
Yeah.
I think for me, just talking about the family component, and also, going back to people not really like jumping and skipping on their way to treatment, but it is about them joining in. So this is a non-shaming, non-blaming process. And we do a lot of that work through what's called a genogram. And Tanya and I love to talk about the storytelling, which you guys have spoken a lot of since we've been here this weekend. And, just really building that genogram out so that they can see that this did not start with them. Right. When people can see that, it takes this layer of shame off the top. And again, they're able to join. Because shame really, there's my favorite quote, and I'm just going to use it. Yeah. Shame is a bully, grace is a shield. And that's Ann Voskamp. She does a lot of writing regarding mental illness and addiction. And it's just the truth. Like if you feel shamed, you almost can't join in a process that is, life-giving, because you're just blocked from getting that help. And so even talking about stigma, things like that, I mean, there's a lot of that out there. But when we begin to kind of open that conversation up with families, Tanya and I are not secret keepers.
No.
And we talk about that, the importance of, you're as sick as your secrets. And when we begin to kind of give a safe space for those conversations to occur and to talk about these hard things, like you said, this is a hard work. We're talking about the hard things with families. We really are. And we're going in probably they're most vulnerable. They're most, that sacred moment though, that is just, it's like they feel like everything's falling apart, but Tanya and I know that things are just getting good, so that they can move forward.
Thank you. Do you see a place for that sort of caught off guard type of intervention? Is there a place for that, or do you see it always being appropriate for an invitational?
I could say, I think that there are times when people are very close to death. Say they're using substances that are, they're just ticking time bombs. And I still believe, if you can start with the invitation, but I do think that there are cases where, for whatever reason they can't join, and then, to move into, so this is done in phases. The ARISE model actually has kind of a space for that, and it's really increasing kind of the families. There's kind of a pressure. I think with everything, there's like either an internal or an external. We all would prefer internal. I'd rather that, it not be some external thing that comes on them, like legal or, illness, or even for them to get injured, or, anything like that, death, whatever. But for them to feel that kind of internal pressure that comes with the family, just increasing their severity of, like, even holding boundaries, or, we cannot join you if you're going to continue doing what you're doing. So I think in that light, that's what we kind of see.
Yeah, and I'll say, the way that the model works is that it is invitational, but we love it when they show up for the first meeting. And I will tell you that we have great success with our clients showing up in the first meeting. Our person of concern, that's what it's called in the ARISE model. But, sometimes I think the most we've had is maybe we meet with or without them. So most family members, the persons of concern, they can't stand to think about their family members meeting and talking about them. They're just not going to have that. So most of the time they're going to show up. Or they get mad and they say, I'm not showing up because I'm going to boycott this and I'm going to make it not happen. But what we do is we say, no, the meeting's going on with or without you. And we tell the family member, we're just facilitating, you need to understand. So we're kind of behind the scenes, we're coaching the family, but we'll tell the family member, that's great, let them know the meeting is going on with or without them. So about the most that we've made it is about 3 meetings, and the person comes in. So again, it is a little concerning sometimes if we know time is of the essence. And sometimes we have to think about that and get creative with that. But it's, and again, we coach the families. I will tell you recently that we did an intervention where the family, even though we totally scripted how to invite their loved one to this meeting, we get in the meeting, there were 18 family members, which was awesome. Awesome. Strength in numbers, that's what it's all about. And, the first thing that the father had to say is, well, this obviously is not a financial planning meeting. And Alison and I just kind of looked at each other because we never knew that our person of concern was told that it was a financial planning meeting. So that, wasn't what we had planned. It wasn't what we had asked them to do. But again, we're guiding and we're coaching, but at the end of the day, the family kind of,
They're the ones doing.
They're the ones doing the work. They are the ones doing the work. I will tell you that was a success. It was probably, aside from that one little piece of it, it was textbook perfect. We did that genogram. We've made that case of, look, this didn't start with you. Look at all of this red, indicating, addiction, alcoholism throughout the generations, trauma, some significant trauma that we were able to highlight. And then each family member went around the room and expressed, how that person's drinking was affecting them, how it was making them feel. and what they needed her to do. And by the end of the night, I mean, she's just completely disarmed. And it was a yes. And she was in treatment, within the next 48 hours.
So, sounds like you do a lot of work with the family.
Yes.
And you work with the family for a while after the loved one hopefully gets help. What does that look like in terms of the work with the family while their loved one is in treatment, and then ongoing? And this will be my last question, but if you could just speak a little bit.
Okay.
I'll speak to that. So what we're doing is we're meeting with the family especially while the loved one is in treatment. They're getting help, they're getting education, they're getting, to be able to work with therapists and go deeper and do that deeper work. So, although Tanya and I we're not therapists, we're not clinical. What we do is we have meetings. We then direct the family members when it's evident that more work is needed. We help them get connected to therapists. Sometimes we've had multiple people go to treatment. Sometimes we've had, maybe there's groups that they can be a part of. That's a big part of what we do is, getting the family members connected to Al-Anon, Nar-Anon, any of those 12-step groups or beyond that. It's kind of whatever resources we can find that we can help those family members get to. It's also with the treatment centers. So what we find and what we typically work with is treatment centers that have a very robust family program, making sure that they are connected to that. Some treatment centers do it better than others. I've heard really good things about what you guys are doing here and connecting with families, and so that's very important to us. All we're doing is supporting that. We're saying, if they give us any kind of pushback on, I'm busy that week, we fight that with you guys. We join along with you. We love to collaborate. We know that we're part of a bigger team, especially when we've got a loved one, one of the loved ones going into treatment. We know that then we're joining you in all of that. So although we're not clinical, we definitely point to all those clinical pieces, but we still have meetings with the families to discuss things like, so when a loved one goes to treatment, sometimes, and we know we're always sending them to great places that have great food, but one of the key things we get is this food is awful. They are hurting us here. We don't like it. The sheets are like really low count, like the full gamut. We hear all of it. And so we remind the family, it's okay to hold your boundary. They really are being taken care of well.
Yeah.
I promise you that. So that's kind of an important part that we play, and we continue those meetings. So again, for 6 months, if the loved one's staying in treatment 30 days, we're still meeting. If they're, sometimes it's 4 months. It just depends.
Yeah. So we also do things like we work with them on helping them identify how to not enable. And so, we'll have them reading books, we'll have them listening to podcasts. We may bring, I'm shameless. I went to a PALS meeting a few weeks ago or so and picked up some tools from there on enabling, in fact. And so we work through, different things with them to get them fully prepared for when their loved one comes home. One of the things that we do each and every time that we meet is we do check-ins. We want to make sure everybody's doing okay. And we've got about 6 questions probably that we ask each person in each check-in. And one of them is, do you have any agenda items? So they're bringing things to the table. So it may be, maybe there's a young child involved, and, we help them dialogue around, how to message to that young child. Where's mommy? Why is mommy gone? Things like that. Maybe we connect that young child with a therapist. But whatever they bring up. I mean, it could be. I mean, we've had problems with dogs. And so we just facilitate. But the big thing that we do is we keep the shaming and the blaming out of the room. And we make sure that we're helping that family move forward. And it's beautiful because we see divorced parents that have come together for the first time in many, many years for the good of their adult child. And so healing just comes about, just organically. And so we just see so much transformation. It's really a beautiful, beautiful model. And we do a lot of it. And so we've seen it work over and over and over.
Well, thank you so much. It's been really informative and wonderful to have you guys.
Thank you so much.
Thank you.
Thank you so much.
Yep.